When people come into one of my clinics for tinnitus, one of the first questions they often ask, sometimes before they've even sat down, is, how long is it going to take before I'm better? And I completely understand why. Tinnitus is exhausting. It's loud, it's relentless, and by the time most people make it to see a specialist, they've been already dealing with this for months or years. They want relief and they want it now. So I'm going to answer that question today honestly, not with a number I pulled off a brochure, but with what my patients actually tell me after 20 years of treating tinnitus. I'm Dr. Lane Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. Today, I'm going to walk you through realistic timelines for 4 of the most established treatment approaches in tinnitus care: hearing aids, linear bimodal neuromodulation, tinnitus retraining therapy or TRT, and cognitive behavioral therapy or CBT. Not the marketing version of those timelines, the real clinical version. Before we get into specifics, I need to say something that a lot of people who have tinnitus don't want to hear. Tinnitus treatment is not a quick fix, but slow doesn't mean hopeless. It means we're treating a nervous system pattern, not flipping a light switch. For the vast majority of people, tinnitus treatment is not a single appointment, not a 30-day program, not a supplement you take for a few weeks. The reason is neurological. Tinnitus is a brain-based condition. Your auditory system has reorganized, often over months or years, in response to reduced soundput from the cochlea. Getting your brain to reorganize again in a better direction takes time. That's not a failure of treatment. That's how the nervous system works. Here's what I tell my patients. Most people start noticing meaningful improvement in the first 1 to 2 months of treatment. Full benefit, what we call habituation, where tinnitus stops dominating your attention even when you can still hear it, typically can take some to 12 or maybe even 18 months. Some people get there faster, some take a little more time, but chasing a quick fix usually means spending money on things that don't work while delaying on the things that do. With that context, let's talk about the treatments. For people with coexisting hearing loss, which is often the case with tinnitus patients, hearing aids are often the foundation of everything else. Here's why they help. When you have hearing loss, your brain is not receiving the sound information it expects. It compensates by cranking up its own internal volume control. And that compensatory hyperactivity is a major driver of your tinnitus. Hearing aids can put the sound back in there. When the brain starts getting adequate sound again, that hyperactivity starts to settle down. How quickly? Research actually supports some early wins here. A meta-analysis published in the American Journal of Audiology found statistically significant reduction in tinnitus distress at every time point measured, immediately after fitting, at 3 months, at 6 months, and at 12 months. That immediate reduction is real for a lot of patients. Many of my patients notice their tinnitus feels less prominent within the first couple of weeks. That said, immediately after the hearing aid fitting doesn't mean the tinnitus is gone. It means the brain is getting more sound. There's more competition for your attention and the tinnitus becomes less prominent. Full benefit keeps building over following months as your auditory system adapts. Most of what hearing aids accomplish with the tinnitus will happen in that first year. One thing that research makes clear: properly verified hearing aids, meaning they were fit with real ear measurements, outperform improperly fitted hearing aids at every time point, with the gap widening significantly by 12 months. So if you're wearing hearing aids and they weren't verified with real ear measurements, that's worth asking your audiologist about. Real quick, if you're finding this helpful and want straight answers, hit that subscribe button. I put out videos like this twice every week. Real information from inside the clinic without all the wellness fluff. Now let's talk about Lenire. Lenire is FDA-approved bimodal neuromodulation therapy. It delivers tones through headphones while simultaneously delivering gentle electrical stimulation to the tongue. It's the most clinically significant technology we've added to our practice in years, and the research behind it is really compelling. Lenire's protocol is 12 weeks, an hour of therapy done per day, usually 30 minutes in the morning, 30 minutes at night, and the data is strong. A 2025 real-world study published by McMahon and Lim, published in Communications and Medicine, analyzed 220 patients that were treated with Lenire in Alaska and found that 91.5% of patients with moderate or worse tinnitus reached the threshold for meaningful improvement after 12 weeks. Nearly 80% had crossed that threshold at 6 weeks, and those numbers are remarkable. I talk to my patients about them all the time, but I also tell every Lenire candidate, 12 weeks can be a checkpoint. It's not always the finish line. The honest guidance from both Lenire and from the clinicians prescribing it is to plan for 12 weeks to 12 months. Many patients see improvement at that 12-week mark, but they keep deepening their improvements as they keep going on longer. That's because the brain is consolidating the changes that the neuromodulation has initiated. Some patients are where they want to be at week 12. Others need a little bit more time. Others are still progressing 6 to 9 months out. This doesn't mean Lenire doesn't work. The response rates are among the best we have in treating tinnitus. But if you expect a switch to be flipped at week 12, you may feel discouraged even while you're on a completely normal trajectory. Tinnitus retraining therapy combines sound therapy with directive counseling to change how your nervous system classifies the tinnitus, moving it from a threat to neutral background noise. And that process is called habituation. And it's the goal of long-term tinnitus management. The research on TRT has more variability than in cognitive behavioral therapy, but the clinical evidence does support it, especially when the counseling piece is done right. Studies suggest most patients see meaningful improvement in their tinnitus distress within 12 months, with the protocol designed to run between 12 months and 24 months. Early wins do happen here. Most patients start noticing reduced emotional reactivity. That jolt every time the tinnitus spikes starts to diminish within the first 3 to 6 months. But the full habituation process does take longer. And here's the thing I want to be clear about. TRT is not just sound therapy. A lot of clinics will hand someone a sound generator and call it TRT. That's not what it is. The directive counseling, where a trained clinician actually works with you to reclassify how your brain responds to tinnitus, is what drives that neurological shift we're looking for. Without it, you have sound therapy. That's not nothing, but it's not the same as TRT. Cognitive behavioral therapy doesn't target the tinnitus itself, and that's worth understanding before you start. CBT targets the distress, the anxiety, the catastrophic thinking, the hypervigilance that often makes tinnitus so consuming. It changes your relationship with the sound, not the sound itself. For that goal, CBT has the strongest evidence base of any tinnitus treatment. A Cochrane systematic review of 28 studies with nearly 2,800 participants found CBT significantly reduced tinnitus-related distress compared to no treatment at all. CBT programs in those studies ranged from 3 to 22 weeks of weekly sessions, and also a 9-month smartphone-based CBT trial found significant burden reduction at 3 months that continued with gains through 9 months. That's a shorter active treatment window than TRT. For many patients, measurable results show up within those 8 to 12 weeks of structured sessions. In my practice, CBT is often the first or a concurrent treatment for patients whose primary struggle is the emotional weight of the tinnitus, the anxiety, the sleep disruption, the sense that this sound is running their life, which leads directly to the most important point I want to take. The patients who do best with their tinnitus treatment aren't the ones who find a single perfect treatment and wait it out. They're the ones who have treatment plans that combine multiple approaches. Hearing aids address the auditory input problem. Lenire works at the level of neuroplasticity. TRT rewires the threat response, and cognitive behavioral therapy addresses the psychological amplification of distress. These aren't competing treatments. They work on different parts of the same problem, and combining them appropriately almost always produces better outcomes than any single approach alone. Something I want to flag here though, because it matters. Progress often shows up before the tinnitus volume changes. I've had patients come in at 6 weeks frustrated because the sound is still there, but when we ask the right questions, they're telling me that they're sleeping longer and reacting less when the tinnitus feels like it's running their life, and they think about it less during the day. That means the treatment's working. Volume is often the last thing to shift, not the first. In my practice, a comprehensive plan for moderate to severe tinnitus might pair hearing aids with CBT from the start, add Lenire for patients who meet the criteria, and maybe layer in some TRT principles throughout the counseling. The specific combination depends on your tinnitus profile, your hearing, and what's driving your distress with your tinnitus, which is why a thorough evaluation matters before any of this starts. The overall realistic window, most patients are going to see meaningful improvement within 1 to 2 months of starting treatment. Full benefit, where the tinnitus is genuinely moved to the background of your life, typically will take up to 12 or 18 months. For some people it goes faster, some people it's longer. That's not a discouraging timeline. That's a treatable condition responding to evidence-based care. Now drop a comment. How long have you been dealing with tinnitus, and what treatments have you tried? Your experience helps other people watching this figure out what their next step is. If you want to go deeper on any of these treatments individually, I've got detailed resources in our free learning center. The The link can be found in the description. No email is required and there's no sales pitches there. And if you're here in Northern Utah and you're ready for a real tinnitus evaluation, not guesswork, you can schedule an appointment in one of our clinics along the Wasatch Front. You can find a link to do that in the description as well. Thanks for watching.